webinar will start in just a couple minutes. Thank you all for joining. So we're going to start this webinar because it's going to be recorded and available also for anyone who would like to see it at a later time. It's going to start my video, and it's a little cold here in Los Angeles today, so and a little bit of raining, but we're going to kind of get started a little bit today and chatting about eyelid and cosmetic procedures, but also everything about the eyelid that anyone wants to know. And I know several people had sent in messages and sent in questions, which we're also going to get to. And I think I can get to the questions by kind of walking everyone through some patient examples. And I know that there are kind of lots of questions about the eye, and I'm going to very specifically answer those. And they're all going to be based upon the eyelid position, like ptosis or blepharoplasty or eyelid retraction, things like that, and also about thyroid eye disease. So I'm going to share my screen and I'm going to walk through some patient examples. So this is an example, at least to start to the discussion about lower eyelid blepharoplasty. And lower eyelid blepharoplasties are something that's kind of complicated because it's when the fat around the eye begins to push forward and underneath the eye, causing fat bulging. A lot of times this can also be fluid too. So one of the most important things in when anyone sends me photos or wants me to evaluate them is looking straight ahead, but then also looking up. Because when you look up, you rotate the fat that is underneath the eyes forward. And that tells us how we can best treat this problem. So for example, this person, they have a couple fat pads underneath the eyes. One is about right here, and one is over here on the other side. Now, the uh, area that we can see, I'm just going to use a little laser pointer. Hopefully it works. The area that we can see after surgery is how much smoother that fat can be, and that cheek and eyelid contour, almost where it becomes a very nice, smooth process that is going on there, and that allows us to really kind of smooth out the lower eyelid. So you see this ligament here, and then this fat pad, and down below is usually edema, and that's fluid. And that fluid can be often due to fillers, and fillers can create a lot of fluid. So sometimes I'll do a non-surgical lower eyelid blepharoplasty with fillers, but many times what we have to do is really take this fat right here and take the fat under the eyelids and kind of roll it down onto the cheeks so that the fat now creates a very smooth structure onto the cheekbone. And this particular woman also had a little bit of her upper eyelid was a little high, wanted to see just a little bit more of eyelid show, or what's called the platform. This area is called the platform. It's kind of where you can put on eyeshadow or mascara. So then a lot of times that is something we want to certainly be symmetric as much as possible and really take into account and consideration. So this is another example when we start to think about lower eyelid blepharoplasty, especially in patients who have prominent eyes. Now this patient has pretty prominent eyes, meaning that it could just be born that way, or they could even have, one of the more common things is have thyroid eye disease. But even just being born that way, half my patients just, are kind of like that, just because that's the way that they were born. And, when they have relatively prominent eyes, meaning that the eye relative to the cheekbone comes out over top of it. What that does is that causes all the tissue behind the eye to kind of spill forward. And you can see here it causes these areas where there's a little bit of fat prominence. But most of this is because the eye is pushing forward. And you can kind of tell that because you can see a little bit of eyelid retraction, or you can see this little bit of white underneath the eyes. And what that does is that tells you is a good sign that there is a little bit of eye prominence, especially when the eyelid kind of scoops down like that. And we can fix this contour. This is just a contour problem of the eyelid, but it's easily fixed by moving the eye back just a little bit, which is another outpatient surgery can be easily done. But we can deal with these lower eyelid bags and lower eyelid blepharoplasty in a manner similar to this. And here, what was done is that the eye was moved back just a little bit. You can already see the softer appearance. We took this fat and kind of rolled it onto the cheek. And you can see the improved contour of the lower eyelid, but also just the dramatic improvement of the lower eyelid and cheek position. Really kind of gives a whole new and rested appearance. Um, that it really allows you to kind of see a very natural result, and a result that where you don't see kind of staring of the eyes, but people don't look different. They look kind of the same. It's their same eyelid, that they've always been born with. And you're not really altering it, but you're just giving them kind of a rested, much nicer, softer appearance. In some people, you can do this with fillers, and in others, you can't. Because fillers sometimes can just cause too much of a bogginess, and it can look very unnatural. And some people that it works great, but in others, surgery is better. And honestly, it kind of requires a virtual consult to really be able to determine that. So a couple of the questions that emerged is eyelid retraction. What is it? What causes it? Well, I'm going to talk a little bit more about eyelid retraction, but you can already see it on this photo here. You can see that there's the lower eyelid is retracted away down lower than the eyelid. And in here, it's right up to the colored point of the eye. And ways we can treat that is we can release the eyelid, we can move the eye back, but we want a natural result. So whatever has caused this problem is how we want to have an improvement. So a lot of times that could be just simple eyelid surgery, and that can be maybe you had a scar or some type of an issue, or maybe just a little asymmetry. And we can release the eyelid and make that better. But sometimes when the eye is in front of the bone, it requires a little bit more surgery, usually about an hour or so, to pull the eye back or to take away a little fat from behind the eye and allow that to fall back really into place. And so the treatment option really has to be customized for an individual patient, because that's really the most important thing. We also saw a little bit about blepharoplasty. And here we were talking about lower lid blepharoplasty. I'll talk a little bit more about upper lid blepharoplasty. And for lower lid blepharoplasty, the most important thing is not to remove too much bulk, not to remove too much fat. Occasionally you do, but it's really important usually to rotate the fat or to conserve this fat, especially if you're young. This you can see this girl is relatively young, in her 30s, but just had these pockets of fat that just heated. And this can be treated, very discreetly and, with a targeted approach. Don't need a big surgery, but often you do need to target this approach and conserve the fat. And I'll rotate it down onto the cheek, especially so that it appears much more youthful over time. Now, I wanted to give you a dramatic example of eyelid retraction. And this is a little bit of a different photo. It's kind of focused here, but also it's a 3D photo, which I often take of patients, but that's kind of why it looks just a little odd. But what it does is it really demonstrates the eyelid retraction. I'll keep using different pen colors here so that we can mix it up a little bit. Let's use white. So here you can see the eyelid retraction. Here's the eyelid, and you can see even how red the eyes are from being pulled down. Now, most of this is due to the eye being pushed forward, but there's also a little bit of scarring that people can get, especially after a blepharoplasty. Sometimes you can even treat that non-surgically and release the scar tissue with medicine and a little bit of tissue expansion. But sometimes you actually do need surgery to actually do it. And to improve it. In this particular case, this was pretty severe eyelid retraction with a very small midface. That means that the midface here was really kind of shallow, and the eye kind of stuck out over the bone. So in this particular circumstance, what you have to do is kind of fix the underlying issue. And that means moving the eye back a little bit and improving that lower eyelid contour. You can see it after. And so certainly, kind of born with just a little bit relatively prominent. This is only about 3 weeks after surgery. So still, still healing, still a little bit swollen. But already you can see a big difference of where the eyelid is sitting, much more normal and a natural contour to this patient. This patient had thyroid eye disease, so They did have other things going on, but this is a way to dramatically improve this particular situation of eyelid retraction. And for cases where we do them, after blepharoplasty, really no different. It's a combination moving the eye back potentially and raising the eyelid. And if the eye is too prominent, you can't raise the eyelid enough. That's why surgeries fail time and time again. I often see patients who've had multiple surgeries, but you can't push a rope up a hill. You have to address both components, both the eye prominence, but then also the eyelid. And one of the questions that came and says, we remove the fat. Do you actually cut it and take it and replace it with a filler or artificial fat? So it's a really good question. And what I'd like to do is actually, so when I don't have a model to show you, but behind the eye, there's a variety of fat. And I can get to that fat from inside the eyelid and kind of suck out a little bit of fat from the eye, behind the eye, and then the eye falls back into place. So in having this eye that's bulging out, now it's in a much more subtle position. And that's what we did with the last case, where we actually, in this particular case, where moved the eye back in a really subtle way, no skin incisions, and we're then able to allow the eye to fall back in place, and then the eyelid comes up into a much better position. And in the subsequent case, I actually did that plus release the eyelid. And sometimes you can even use a little spacer graft if needed here to also improve the eyelid. A lot of times that's not needed though to get this type of result. So what happens if you've had a blepharoplasty or you've had some medical conditions or even a trauma? A lot of patients will be in a car accident and they'll come to me and they'll say, what can I do? How can I improve things? Well, here what I want to do is kind of point out what terminology we use and also how we can improve things. So I'm going to, just to change it up, let me try magenta. So here what we see is eyelid retraction. So the eyelid is pulled down, is coming down. It's a little harder to see because she's looking down here, but the eyelid is pulled down up there. Now I think everyone's a pro at spotting eyelid retraction because they can see the white under the eye and the contour of the eyelid. It's like that big almond that kind of rolls out. Well, when we fix the eyelid retraction, in this particular case, we could probably move the eye back just a little bit, in a surgery that I do hundreds of times a year, or we could probably just elevate the eyelid. But either way, we probably want it to look a little more similar to the other side. And one of the first questions I always ask is, which side do you like? What are we talking about? Symmetry, etc. And this is a case where there's a lot of needs for symmetry. Now, also, there's ptosis here. So you can see that by seeing how low this eyelid is. You can see where it crosses, ptosis, where it crosses the pupil. It's much lower on one side compared to the other. And you also see this large eyelid platform. And usually the platform is the most noticeable thing. Any woman that's ever put on mascara will disguise any subtleties, using this platform. So what I have to do is think about raising the eyelid itself, but also adjusting what is seen, how much platform is seen so that it's identical on both sides. And sometimes that's hard because you have to remove a little bit of skin or a little bit of bulk or a little bit of upper eyelid and doing an upper eyelid blepharoplasty in addition to a ptosis procedure. So sometimes that can be, quite a difficult, scenario, but it's one of the things that's what we do, and that's why we do with eyes. And here's just a selfie. Most of my patients fly in to Los Angeles, so I apologize, I don't have a formal before and after, but you can certainly see now a tremendous more symmetry between the two eyes. And that was our goal. Our goal was not to create an issue where we did she just wanted a natural look. No brow lift, no, overdone blepharoplasty. She just wanted symmetry between the two sides so that she didn't look obvious. And that's what I think we achieved. We now have good symmetry between the upper eyelid and the on one side and on the other side. Drew that a little bit off, but now also the platform is the same. And those are really important and key critical things. So really it's understanding what people want. Do we want to raise the brow? Do we want to have a much more open platform here for the eyelid? You know, if that's the desire, or we want to go very natural and just achieve symmetry. And so these things can all be achieved. Just depends on what you're looking for. So here's an example, and I show this because there's no surgery done here for this person. And this is subtle. This, you know, the other cases that we've seen have been a bit more, um, you know, look more obvious. Now here what you can see is ptosis. And I'm going to go back to, you can see ptosis. You can see how low this eyelid sits compared to here. And what we often look at is the white spot in the pupil. And you can see how close it is on this side versus this side. And then also you see this long eyelid platform. So now you're experts at spotting this. So you know that this is the droopy eyelid. And also on this side, there's a little bit of eyelid retraction. This lower eyelid, it's a little harder to see, but is a little lower. It just looks a little more off, a little more prominent even, a lot more white showing than the other side, and even accentuates that. Also, she wanted a little bit done with her cheeks too, just to kind of help with the dark circles, which also can be done. And so one of the things we did is, without any surgery, is just to elevate using filler and using a little bit of Botox. And now there's a new drop called Upneek that really is going to enhance this. And you can get this from a prescription that raises the eyelid. And that's really quite a game changer, because now instead of injections, you can do this just with a topical drop. And I could achieve the same result now with a drop called Upneek. Raising this eyelid just so that it doesn't clamp down so much with a little bit of Botox, and then giving a little filler differentially under the eyes just to make it much more subtle in appearance. Now, if you saw her this way, you'd say, well, I don't know that I see a huge difference, but when you see the before and after, and you can imagine if this were you, you can see what a big difference this would be, especially, you know, an hour in the office, and then you kind of go home with very little downside and very little bruising, etc. And so I think this starts to address this, what is ptosis, which I think we can all see now. And what are the surgical treatment options? Well, if I wanted to fix this with surgery, I could do a little bit of surgery underneath the eyelid and to lift that eyelid. Often you can even do it in the office. It takes about 30 minutes, very predictable. Even non-surgical with a new drop called Upneek, Upneeq. It can be prescribed by your ophthalmologist. Now, the drop for 10 hours can raise up your eyelid, has very few side effects, and really is a tremendous new addition to be able to open up the eyelids really nicely and give symmetry. The hardest thing sometimes is revision surgery for ptosis, because once someone does a surgery, there's scar tissue, and most of my cases are revisions, but you have to kind of undo what was done sometimes and almost kind of start again. And the scar tissue can be a little unpredictable. So revisions are some of the hardest things that I deal with, but also some of the most enjoyable, just because there aren't too many people in the country and world who do them. So this is now talking a little bit more about symmetry and personal style, etc. And I apologize, I did not get the after on here. So I apologize that we actually took away this symmetry, and and for some reason that one's, oh, there it is, okay. So this is a very early post. I think about only 2 weeks. You can see that but you can see that the incision line is already starting to heal. But what we did was just an upper lid blepharoplasty, because on this particular case, you can see that the eyelid height is about the same. So there's not true eyelid ptosis, but the difference is this hooding. And we had a long discussion as far as, well, should I add volume on this side and make this a little heavier and a little fuller, or take away on this side. And finally decided that the patient really wanted this side, a little bit of it removed. There's no other Botox or anything. He's just kind of holding his brows a little higher for the camera, I believe. But you can also see that the incision now is already starting to fade. And this is, I think, 10 days, just, removing the stitches. And then, with a little brow relaxation, you never even see that. And a really good symmetry then later on to, improve that. So here's a case now where we start to pull together a lot of the components of things that we do. And if you just, looked at this patient, you'd say, well, okay, she has a little bit of prominent eyes because we can see a little bit of eyelid retraction between the eyelids, a little bit pulled up. Then there's also a little eye prominence. The eyelids are in good height, good position, maybe a tiny bit high, but very good. Not much eyelid platform. She really missed having this low set, almost not sleepy, but much lower eyelid platform where she could apply makeup and really kind of missed that and felt that the eyes were too wide open. Certainly now I can see the fat prolapse that we can automatically now begin to really distinguish and know what to do with it. But also now a different component, now of facial shaping and how we can differentially lose and gain face shape. And part of this is the buccal fat. And the buccal fat, especially in cases like thyroid eye disease, but also just in general, can get expanded and makes the lower face look bigger. And it almost makes the lower face look boxy instead of like a V shape. Normally we think of a V shape in the lower face, but we can start to think of a little bit of a boxy lower face. And so that's also something that we can deal with. So this patient had an upper lid blepharoplasty, just removed a little bit of skin, very straightforward. Just wanted to show off some more of that eyelid platform and let this eyelid come down just the tiniest bit. Fat injections through into the brow and into the temple and into the cheek. That was just to allow the more fullness, more youthful fullness to the cheek area. And then and then also the lower eyelid blepharoplasty, taking this fat, rolling it down onto the cheek, create a smooth, volume-enhanced cheek, and removing a little bit of buccal fat. And we also move the eye back a little bit with a little fat decompression by removing a little fat from behind the eye and then repositioning some of this fat. So in about 3 hours of surgery and a week or two of recovery, very little pain, really just a bit of bruising, and just restricting, activity, not as much activity as far as, no heavy exercise, you see a really nice improvement. Now very subtle, but very smooth lower eyelid, cheek junction, eyelid retraction is gone, symmetric lids, and a much more now triangular face. So this patient has thyroid eye disease, and a lot of my patients have thyroid eye disease or just genetically bulging eyes. And so a lot of my revisions for people who've had bad blepharoplasties come from bulging eyes or other things like that. And so what we often do is because those patients always get into trouble. And when you have a prominent eye, if you have a blepharoplasty, you then can't close your eyes or causes eyelid retraction. And so a lot of times I have to fix those. And usually it's dependent upon fixing the position of the eye first. It's kind of like building a house. You definitely want to build the foundation first and then add to it later on. And then remove any extra tissue, whether that be skin or whether that be fat, whatever that may be in the upper eyelid. Dealing with the lower eyelid, if there's fat prolapse, we deal with that in the blepharoplasty. Here, she just has a very small cheekbone compared to a relatively prominent eye. So I take fat from inside the thigh, very tiny little pieces of fat that kind of almost kind of like, that's suctioned down almost like micro liposuction, and then place that into the cheek. or other places, temple, brow, and then that allows a really dramatic improvement. And then here, just kind of reducing the cheek buccal fat. And this patient was a patient I did on television here in the US for a television show called The Doctors. And she was an amazing person, a single mom who really, this disease kind of wrecked her life. And we were able to give her a transformation. And I think The Doctors episode is actually on our YouTube, but really a wonderful time that we had. And I can see an improvement. So much less eyelid retraction going on. Upper eyelid still healing, still a little bit. She's very early. We had to do this for the TV show, but still about 2 weeks. So this will even open up a little bit more, the buccal fat narrowing her face and kind of giving her eyes back to where they were. And that's really what she wanted to achieve, is that she felt she lost her eyes and her appearance. Here's a patient flew from Australia to see me. Again, also thyroid disease, but you could also just have genetically, prominent eyes or a lower eyelid blepharoplasty that went bad. But here you can see prominent eyes, and we wanted to also do a little bit of an upper lid blepharoplasty, but not a lot for him. You still want to maintain that male appearance. Move the eyes back. And then he needed some fat injection. His face had become round from, from the disease and etc. And as you get older, the face becomes so round and square-like on the bottom. So what we wanted to do was to kind of facially shape him, was to add some volume in around his eyes so that they become less prominent, in around the cheek area and to the brow area, etc. And then take away volume from the lower face so that you can now almost do a facelift without actually any lifting. So what you're doing is you are allowing that tissue, reshaping that tissue, almost like modeling clay. And so then what we could do is he still wanted to retain the slant of his eyelids. That was important to him because he didn't want to change the way he appeared. And so he wanted just to look very normal. And so very subtly left his canthi a tiny bit lower, so just on this side right here. The edge is called the canthi. And so, but what we did is then narrowed his face, augmented the cheek area, pulled this in just a little bit, and gave some fat injections up through the upper brow. So dramatic difference for him that he was able to achieve. And again, was able to fly back to Australia in 7 days after the surgery. So this is I think this is one of the last patients that I was going to show today. And we're about half an hour in or so. And if there are any other questions, please feel free to submit them. This is a model, and she developed thyroid eye disease and bulging of the eyes. She developed them both, but the right was a bit worse than the left. And she really has a very thin face, very small girl. She's a model and very, angular proportions, for cheek, etc. So really doesn't need any volume removal of her lower face because she has very strong features. But one of the things she does need is she's volume depleted under her cheek area. And so we want to add some fat there. I also can see that, the eyelid contour is very different. This eye is much more bulging. And there's also, more heaviness up through here in this upper eyelid area. So one of the things that we did is left her cheeks the same, gave her some of that volume through the cheek now, lowered the eyelid just a little bit. She's kind of squinting here, I think, in a little modeling pose, but eyelids are just a tiny bit higher than that because we didn't actually touch this one. And then took away some of that extra hooding of the upper eyelid so that she can use makeup, even though she's not wearing any now. Also moved this eye back too, because she was not that happy with that appearance. And now giving her back what she's essentially what she was born with and looking very youthful. So hopefully that has allowed us to kind of chat about, what are the options here, and what are the options if you have prominent eyes, if you've had a blepharoplasty and you're unhappy with it, what you can do. And we start by talking about the upper lid, the brow, the lower lid, and just, systematically working our way down. And you can also think about if you've never had a blepharoplasty. Well, if you have prominent eyes, you are at a higher risk of having issues. But if not, then what kind of contour would you like? How much of the platform do you want to see? And these are all details that you know if if you weren't doing it to yourself, you probably wouldn't be that interested in them. But when when it's you want to take a look at old photographs, and that's the first thing I want to look at is take a look at old photographs and see what you look like before, because we want to go back to that. Most people, most of my patients at least, do not want to look like someone else. They just want to look 10, 15 years younger, refreshed, not natural appearance. And so for most of my patients, we're doing those types of improvements rather than making you look like somebody else. Because most of the time, people don't want that. They want an enhancement, not to look like someone else in the mirror. In fact, most of the patients who complain about blepharoplasties and things like that, really they say, I just don't see myself in the mirror anymore. And that's the problem that most people have. Well, certainly, if there are any questions that do come up, I'm just going to share my screen one more time because I apologize for the sirens here in Los Angeles. Um, you can email me. Uh, you can email me, and here is my email. At any time to to ask questions, whatever you may need. Usually email is a little easier since most of my patients do fly in. Most of the surgeries I've talked about today actually are relatively straightforward in that I do a couple hundred of those types of surgeries every year, and so very safe in general. But any surgery has to be taken and considered the full range of processes. So what we do is I have an introductory webinar or video consult with everyone, and then I will then talk to you about any of your specific problems, anything that is of interest that you want to see, anything that is kind of what you're concerned about, and at that point in time, then we can have about a 95% of the plan complete. Most people then don't come for Los Angeles for an in-person appointment. What they do is they book surgery, come to see me, and then we kind of start all over again. We look at old photos, we kind of go through all your concerns, everything like that. Day or two before surgery, all of our patients are COVID tested, obviously, and is everyone in our facility. Then we move forward with surgery, and then most people fly out anywhere from 3 to 7 days afterwards, depending upon their progress. And every patient has my phone number, etc., to make sure that we can take care of people. And so, again, my email, we try to make everyone accessible. Our Instagram page is also, and Facebook page, there's usually a lot of great discussion. So I really want to thank everyone for joining today, and again, it will be available. But really appreciate everyone's attention today. And any questions, just let us know. Thanks so much.